Welcome back, microbiologists. So let's finish up our chapter 1 discussion by talking about some emerging infectious diseases, or some diseases that are coming as new diseases or as increasing in how often, how frequently you see them. Just to review, our normal microbiota are the organisms, the microbes that live on your body without causing disease. They can live on your skin and your intestines. They're part of your biome without causing disease. Once the microbes were considered plants, so sometimes you might see them called normal flora in things probably from like the 1900s or earlier. Now it's typically called the normal microbiome or the microbiota. They can help prevent the growth of pathogens just physically being there, just like a house where somebody lives is less likely to have a vagrant move in compared to an empty house where someone moves in. Your normal microbiome can produce growth factors. They can produce folic acid and vitamin K. Right now you have E. coli in your intestines that are breaking down some of your food that you've eaten and are producing vitamin K to keep you healthy. Your ability to stay healthy, to ward off disease, is your resistance. So a person is resistant to different diseases based on what they are able to protect themselves against. Some of the things that help us protect ourselves from disease would be our mucous membranes. Those would be like the wet parts of your body that line like your throat. Antimicrobial chemicals. Your stomach acid is very acidic. It has a pH of around 1.5 to 3, which is very acidic. It can break down most toxins, viruses, bacteria. Also, your skin. It's a physical barrier that stops something from the air or the water, whatever touches you, can't get inside of your body because your skin is just that physical barrier. Microbes tend to grow not just as a single cell by itself, but in communities sometimes. And these communities are called biofilms. A biofilm is a community of microbes that form, usually they're slimy on a surface. So if you think of like when you wake up in the morning and you kind of run your tongue along your teeth and it's a little bit icky, that's probably a biofilm of bacteria. Or if you've ever stepped in the pond and there's a rock that's a little bit slimy, that's probably a biofilm. Or that dark ring that grows on your shower curtain or your bathtub, that may be a biofilm. They can be beneficial. They can help protect your mucous membranes. They can be good food for aquatic animals. But they can also be harmful. So if they grow on rocks, if they grow on pipes, they can clog your water pipes. If they grow on your teeth, they can cause cavities. They can grow on joint prostheses and catheters and cause infections. And these infectious disease is going to be when the pathogen is able to overcome the host resistance. That means that the pathogen is going to start growing more, producing toxins and doing whatever it does, and result in disease. Emerging infectious diseases are diseases that are new and diseases that are increasing in incidence. So something like monkeypox that was in the news, it was a disease that existed already, but it was suddenly showing up a lot more. That's a disease that's increasing in incidence. Some things that contribute to EIDs would be evolutionary changes in existing organisms. This is how we got COVID. Another virus mutated into the COVID-19 virus. Spread of known diseases to new locations. So I think of like global warming can cause mosquitoes to travel into new locations and bring new diseases. Or being able to get on a plane and bring a disease to a new location. Deforestation and construction. People are now moving into places where disease might have been isolated. Now it's coming into contact with people. And antimicrobial resistance. So this would be something like a pathogen that you're able to treat with normal antibiotics, and then it mutates and develops some resistance. So now you're no longer able to treat it with that antibiotic. So some drug-resistant EIDs that we have MRSA. And I do want to put these last few slides, some of them have been updated. So if you are using notes that don't have the same kind of slide outline, you might have had access to some old notes. please make sure that you take notes based on these updated slides we have and not based on old notes you may have found somewhere. Okay, so our first drug-resistant emerging infectious disease is MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. This is a bacteria that's very resistant to a lot of antibiotics. So we started using penicillin really widespread probably in the 1940s. By the 1950s, penicillin resistance developed. That was okay. We still had other drugs we could use. By the 1980s, methicillin resistance developed. And by the 1990s, there was even resistance to vancomycin. Vancomycin is a very powerful drug. It's usually a very last line drug because it can, it's so powerful, sometimes it can cause harm to your patients. There's not a lot of vancomycin resistance within the United States, or at least in our area of the United States, but it does exist, so it could start being found here. VISA would be vancomycin intermediate resistant Staph aureus, and VRSA would be vancomycin resistant Staph aureus. So this means that a simple little staph infection that used to be able to, you could just treat it with some penicillin, no big deal, get on your way. Now that little paper cut can lead to an infection that could be resistant to things and become suddenly critical to that person's health. Clostridioides difficile, or C. diff. This is a bacteria that is a part of the normal microbiome of most people, but when a patient has been on antimicrobial drugs for a long time, a lot of their normal microbiome might die as a result of that long-term antibiotic use. C. diff is pretty resistant, so it won't die off from long-term antibiotic use, and then we'll take advantage of all that new habitat and start growing all over that patient, causing a very intense form of diarrhea. This occurs in nearly all healthcare settings. If you work in a nursing home or a public health clinic for long, you'll probably come in contact with some sort of policies about how to manage C. diff. And then there's also multi-drug resistant tuberculosis. We're not going to describe this one a lot, but just be aware that there's multi-drug resistant tuberculosis. It has mutated this drug resistance, and that's what makes it an EID. Okay, then some diseases that have spread to new locations. We have Zika virus disease. This was discovered in the 1940s in Uganda, but then we started having human epidemics in Micronesia and French Polynesia and Brazil, and by 2016 it had spread to the United States. Depending on how old you are, you may remember the Olympics in Brazil that were held in 2016, I want to say, and it was a big deal that Zika was going on at the time. People were very concerned about how they were going to keep each other safe. This virus, Zika virus, is spread by the bite of an infected Aedes mosquito. So the mosquito is not what causes the disease, but the mosquito can be infected with the virus, and then when they bite a person, that virus can transfer from the mosquito into the person, so then the person has Zika in them. It can also be transmitted by sexual contact. For most people, Zika isn't going to be a terrible illness. They'll be able to recover. But if you have an infection during pregnancy, it can result in severe birth defects, something called microcephaly, which is when the brain doesn't develop all the way and they have a very small head. That micro means small, so they have a very small head. Then we also have Ebola hemorrhagic fever. This is caused by the Ebola virus, and as it's a hemorrhagic fever, it causes hemorrhaging. That means bleeding internally. It also causes fever and blood clotting. It is transmitted through contact with infected blood or body fluids. So a lot of the places where this disease was occurring were in places that had very strongly prescribed funeral rites, that people would be in contact with the body fluids of the person who had just died, and so it was spreading. And so a lot of stopping the outbreaks of this involved helping people find socially respectful ways to prepare their loved ones for the next life without spreading disease. Ebola hemorrhagic fever is named after the Ebola River in Congo. There was an outbreak in Guinea in 2014, and about a third of the people died. There's another outbreak probably about 4 years later, and then I want to say there was an outbreak again in 2023, maybe 2022. Outbreaks tend to have between a third of those infected up to sometimes 90% mortality rates. Then we have Bovine Spongiform Encephalopathy. So bovine means cow, spongiform means it turns it into a sponge, and encephalopathy means a brain infection. So this is going to take their brain of the cow and make holes, make lesions all through that cow's brain, which affects that brain's ability to control that cow. So here you can see the cow isn't able to stand up or do anything. It's more commonly called mad cow disease. This is a disease that is caused by a prion. A prion is a type of protein that can cause a disease. It's not a whole virus, it's not a bacteria, it's not a cell at all. It's just one little protein. In humans, it's called CJD or Creutzfeldt-Jakob, and it can be, your patient will acquire it. It can be acquired from eating beef that's been infected with the prion. So this cow that's been infected, it needs to be isolated and dealt with in a way that it does not contaminate the food supply. It cannot be used as feed for animals. It cannot be used as feed for people because there's no way to get rid of that prion. If anyone else eats that cow, they will end up with the prion in their brain. Another one is E. coli 0157H7. So I already mentioned you have E. coli growing in your intestines, making vitamins, doing like good stuff for you. This is a strain of E. coli though that has picked up a new gene. This 0157H7 lets it create a toxin. And by having this ability to create toxin, it leads to your patient losing water through their stool, so they end up with a lot of diarrhea. And diarrhea might sound like no big deal, like you have access to clean water, drink lots of water, stay in bed for a few days, stay close to the bathroom, you're okay. But diarrhea is the world's biggest killer of children. So this is actually a pretty important disease worldwide. Then some genetic changes. First, we have East Respiratory Syndrome. This was a problem in 2014, if you remember back that far. It caused Middle East Respiratory Syndrome, and this was caused by a coronavirus. SARS, Severe Acute Respiratory Syndrome, is also caused by a coronavirus. So here's a couple of respiratory diseases caused by coronavirus. They stayed confined, these outbreaks stayed confined to the Middle East and into Asia a little bit. Killed some people, but it wasn't a big worldwide pandemic. Then we had COVID-19. COVID-19 arose in 2019 by genetic mutation. By March 2020, it was declared a pandemic. If you were a student several years ago, you may remember that schools shut down. You were suddenly learning online. It is caused by another type of coronavirus, the SARS-CoV-2, Severe Acute Respiratory Coronavirus 2. There were more than 6.5 million deaths worldwide. As of today, it's probably even more than that. It is transmitted by airborne transmission. So someone has a disease, they cough, they sneeze, they get it into the air, and it can travel through the air to other people. Illness ranges from just a common cold all the way to respiratory failure. There were people who were in the hospital, on ventilators, lots of people who died. It also can lead to long COVID. Long COVID is COVID-19 that instead of just being a week or two of feeling sick, it can last for months or even years. There is a vaccine available. I encourage everyone to get vaccinated to protect yourself, especially if you're going to be working in healthcare. And then flu. H1N1 influenza is also known as swine flu. It was detected in the United States in 2009 and was declared a pandemic. It was a worldwide outbreak all across the world. I remember that year we all had to get 2 flu vaccines. And I had a 1-year-old at that time. And so she also had to get multiple vaccines. We all had to go to the health department and get extra vaccines to protect ourselves from the swine flu. Then the avian influenza is H5N1. So you can see these H and N numbers are different. That refers to what kind of proteins and sugars it has on the outside of the virus. Avian influenza A is a type of influenza A virus. That word avian tells you it's mainly in birds, so it's primarily been found in waterfowl and poultry. We haven't seen a lot of human-to-human transmission, so people who get it tend to get it because they are raising poultry or they are studying wild birds or something. We don't have a lot of human-to-human transmission. Both of these are studied a lot in research laboratories, so that if there is a sudden outbreak, if this does start having human-to-human transmission, we would be able to protect each other from having a sudden pandemic that killed everyone. And then HIV. HIV is HIV is the virus that causes the disease AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. And then HIV stands for Human Immunodeficiency Virus. This is a worldwide epidemic that affects about 35 million people, and there are about 6,000 new infections every day. It will destroy your T cells. Your T cells are part of your immune system, which means then without a strong immune system, these patients are left susceptible to a lot of diseases. So a lot of the things that we saw when AIDS was very first becoming a disease that we knew about, we didn't really know anything about it yet, what was causing it. We started seeing a lot of really rare fungal infections, and rare cancers suddenly start showing up in people where they really shouldn't have had them. So it's these diseases that these people are susceptible to that end up killing them. The virus itself is just destroying their immune system, and then they get these other diseases that kill them. It's an STI, which stands for sexually transmitted infection, that affects both males and females. Everyone is susceptible to getting this disease. There are drugs that can be taken if someone is already infected with HIV to, for the most part, allow them to have a relatively normal life. Using condoms is a good way to protect against it if you are having sexual intercourse with other people. And also there are prophylactic drugs that can be taken by people who are at high risk. Your high risk populations can take this prophylactic drug to help protect them. If they don't yet have HIV, it makes it less likely that they would acquire it. And then monkeypox. Monkeypox causes a flu-like illness and a painful rash. It is related to smallpox. So the first ways that we were treating it was with smallpox treatments, vaccines. Smallpox is a disease which has now been eradicated, although monkeypox still is around. It was declared a global health emergency in 2022, and it is transmitted human to human by prolonged direct contact. So people who are in sexual contact with each other, touching direct physical contact with the sores on one person can be transferred to another person. And not just sexual contact, but any direct skin-to-skin contact between an infected person and can spread it to another person. Okay, so at this point you should be able to tell me what's the difference between your normal microbiome and infectious disease. How are biofilms important? What are some of the things, the benefits they provide? What are some of the problems they can cause? What factors contribute to the emergence of infectious disease? And be able to describe to me, Ebola. What do we talk about Ebola? What do we talk about COVID-19? What do we talk about avian flu or swine flu or monkeypox? All those diseases we just talked about. You should be able to kind of give me a highlight reel of each of those. All right, so you've made it to the end of chapter 1. If you have any questions, please let me know. I'm here to talk about microbiology, or even if you need to talk about something else. Office hours, you can come in, you can send me an email through the school email system or a message through D2L. I'm happy to help in any way I can. All right, I'll talk to you later. See you later. Bye.